Hey everyone, this is Dr. Kelly, and I have a special guest with me, Dr. Sherry. She is a board certified psychiatrist and one of my friends and colleagues. And I wanted her to come on today. A lot of you guys, I remember one day last couple of weeks ago, I posted that I was up at like 2 in the morning, and I said, who else has their sleep cycle messed up? And would you believe that like almost 80 something people came on? I was like, me. So I know that a lot of us are being affected by the coronavirus pandemic in terms of our mental health. Please come on when you come on, say hello so that we can see you. And please like and please share the video. So we have 4 people here, so I guess we can get started. Dr. Sherry, can you tell us about yourself?
Okay, well, I am Dr. Sherry Broadwater. My online name is Dr. Sherry Psych. And what do? I help women and their partners and their families transform frustration and chaos to happiness, healthiness, and safety. And I have a brick and mortar in Atlanta, and I also have a small coaching program. And I am working on a book. It is on hold right this minute, but I have a book that I'm working on to help the busy Black professional woman again be healthy, happy, and safe. So that's what I do.
Great. Please put your questions in the chat for Dr. Sherry as well, and we'll come back and go through all of them. So Dr. Sherry, like I said, just talking about myself, I've had a little bit of insomnia. Even when I do sleep, it's sometimes not rested. And a lot of people have also been talking about the vivid dreams and nightmares that we're all having. So what have you seen as a psychiatrist in terms of the mental effects of the coronavirus pandemic?
Well, I've seen a variety, but mainly focusing on a lot of anxiety. So a lot of worries about safety, worries about sickness, worries about some worries about death, but I think it is that the unknown, the what if, is what really has gotten a lot of people to feel very overwhelmed. And then that's feeling very restless, agitated, concentration is almost kaput for most people. So if you're working at home and it's really struggling to accomplish what you need to accomplish, that is very normal. A fluctuation of energy. Another thing that people are surprised about is the variety of feelings and the sort of the variety of functioning. That sometimes I'm fine, sometimes my mood is okay, then other times I'm like angry as shit or irritable, and so that fluctuation is very normal. And what we know is that there are 7 primary feelings, and they range from fear and disgust and anger to happiness and content. And it is very important that we're experiencing the variety of feelings. 1, 2. The second thing that we have to make sure that we're recognizing if we're staying stuck in one feeling. Like there are some people who are chronically angry. Okay, so then you got to figure out why is anger your go-to default feeling at this time, or fear. That's a big one. And sometimes some people are very fearful. I had one patient who had not left the house in 2 weeks, which a lot of people have done self-quarantining, but she was literally in the bed for 2 weeks.
Wow.
She was scared to get out of the bed, scared to even do anything, even really engage her mom. So that's an issue. But also the flip side, that there are some people who I'm fine. I haven't been affected and I'm okay. And so that also lets us know that there's probably some level of denial that they're experiencing because they're not willing to feel other emotions.
So you made a really good point. Like some days I'm like, oh, this is good. I have all this time to do stuff and be productive. And other days I'm like, yo, I can't wait for this to end. Like, how do you manage the different range of emotions? Like, what is your advice on that?
Well, how do you manage? I think the first thing is, again, knowing that the variations of our emotions during the day and over a time frame are normal. There has to be some distractions. And what I also, another thing that I've seen, and that was your first question, Dr. Kelly, about how people are managing, is that our go-to number of coping strategies and tools are not sufficient. So, and many adults only have a few coping strategies. So I'm going to throw it back to you, Dr. Kelly. What are your coping strategies? What were your pre-COVID coping tools?
It's kind of interesting that I think over the last year or two, I've been working on building my emotional and mental health. Yeah. So I wouldn't say I was ready for this, but I think I was most prepared for this because of how I've been investing in therapy, in seeing you and seeing, my psychologist and, meditating and praying and journaling, like all of that kind of helped me to be more resilient for this. So what I just said, praying, meditating, even though I can't go to my gym, I still go walking for at least an hour 4 times a week. Wow. And it's not only for physical health, and I've lost about 5 pounds. It's not only about physical health, but like walking just keeps me sane. Like if I'm feeling anxious or anything, I just listen to the trees and the leaves rustling and the birds chirping, and I pray and I feel so good after that. Psychiatrists and psychologists are still doing televisits. So even though I can't go into an office, I still make sure that I see, even though nothing is acutely going on with me, I still make sure that I maintain my regular schedule of seeing my doctor. So
yes. And so, Dr. Kelly, you have a variety, but there's also some other things that you're doing, also connecting with girlfriends, talking. You also have some other personal and professional endeavors, and you're working on those things. So
definitely. So I feel more connected to my family now than before, because like I make sure I call my parents every single day, and I make sure I see them, like literally we do video calls every single day. My brothers and I, we do it as well. I think I've been doing more Facebook Lives and trying to sell my book. I've also, interviewing potential clients, and all of that happened during this madness, So it's been a really productive time for me.
Yeah.
Oh my God, Dr. Sherry, I'm the one who's interviewing you. What is going on?
We're talking. This is a conversation. So what I was going to say is that a lot of people haven't been doing sort of that reflective work beforehand, but just because you started making those changes for you. Yeah. But a lot of people have not done those things. And so what COVID-19 has done, it really has exacerbated, it sort of highlighted those voids, that those places in us that are too limited. So when we think about joy and happiness, I had just done a talk on that yesterday, and joy is that internal feeling that is consistent, that is internally nurtured. Mm-hmm. One. Happiness is that feeling that we get that is more externally derived. So like our relationships, hanging out, and just sort of the objects and things that are around us. And most of us are not working on joy. So when COVID happens, because we can't go to brunch, or we can't go to the pavilion to go hang out, because we've watched all the shows. Now we've jumped onto Hulu, so it's just Netflix, and now we're doing Hulu, and now that's boring. So we haven't been really tapping into those creative aspects of us, but also to be mentally happy, you have to have a variety of activities that nurture and provide fulfillment. So that's one of the biggest things that I've seen. People are really just stuck, but they were stuck before, they just didn't know it.
Right. So how do you cultivate joy?
How do you cultivate joy? Well, one thing I think is so important is to take time with oneself. And a telltale sign of really struggling with that is, can you be in your house or be with yourself without anything else going on? Like, do you have to have music going? Do you have to have the television going? And when you're alone, how do you feel about yourself? And what are those aspects in yourself that you like? Some people a lot of people struggle with how they think about themselves. So that's self-esteem, but there's also, do you value yourself? What about self-worth? What about, do you think are you competent? Are you able to do things well, and are you efficient? Are you able to do those things efficiently and timely? And if you cannot, you've got to figure out how to build that foundation of positivity about yourself, because there are some things that you are doing well, one, but two, also, when do we accept that we are good enough? That what I am doing is good enough. How, if do I look good enough? My body is good enough. There could be areas that we want to improve, but there's got to be a good enough mantra and self-belief that we begin to really hold on to.
That's an important point. Like we always say, how you view yourself, how you interact with yourself, that kind of sets the standard for all your other relationships. And it's kind of cliche, but like, it's so true. Like,
yeah,
having that joy starts from within. So what is your advice for people? Like, when this first started, I was like, oh my God, like I'm literally by myself. I live alone. So usually after work during the week, I go to the gym and I come home, I work on some projects and I'm good. So, but on weekends is the time that I usually go out and hang out with friends and all that stuff. So when this social distancing and quarantine started, I was like, oh my God, I have like absolutely no one. So I felt even, I would say, more alone, I guess, or lonelier, however you want to put it. So what is your advice for people who might be going through this, living by themselves and being alone?
Well, it does start with mindset, because being alone, so that's the stance. But the feeling attached to it could be lonely, but it may not be. So it is all about your perception. I think there's another component in this, that there's an absence of touch, actual physical touch, which is, that's something separate. And I do think that it is important that, and I'm going to say this term is a psychological term called radical acceptance, that to get our needs met, to get those closest needs met at this time, will look and feel different. And we will have to, at some point, and even and a technique is, so it's let me say two things. One is compartmentalize. So compartmentalize is to decide to put something, a feeling or a thought or a belief to the side and not think about it, not experience it, so that you can do something else. Okay. That, yes, Dr. Kelly, I don't have anyone in my home. That does not feel good. I feel lonely in this. How can I get my intimacy needs met in a different way, and see how that feels? Got it. So I think that, and because, so not to dismiss it or invalidate it, and not to say that it's not real, but we will have to radically accept that during this time, this is going to feel differently. Okay. And then allowing ourselves to then engage in those interactions differently. So the fact that now you're FaceTiming your parents every day, were you FaceTiming them before every day? Yep. Yeah. And were you FaceTiming your brothers every day? Nope. And how has that felt? How has that felt to do that? I mean, it really showed me what was truly, this time has really shown me what and who are important to me. Yes. And it shows me that even coming out of this, I have to prioritize my relationships. Yes. Yes. Because again, to be mentally healthy. So the first one was to have a variety of activities that are fulfilling, but also to have a variety of relationships that are nurturing and provide joy, that are nurturing, that we are nurtured by and that we are nurturing. So it's twofold. And again, COVID has highlighted for a lot of people that those relationships really have not been as strong, not been as intimate, as close and as satisfying that as we would like. And so another thing, go ahead. I'm sorry. No, I was going to say, I spoke to two people yesterday that I had not spoken to in probably 4 or 5 months. Mm-hmm. And these ladies used to be my dogs. He was like my ladies. Mm-hmm. But because I allowed life to get busy, I had not contacted them. And so again, like you, Dr. Hill, I've been very intentional in establishing those connections. Right. And not only about talking about priorities, I realized, like I have to make
more of a priority when it comes to finding the husband and well, or having him find me, I should say. So
Yes. Oh, I
like
love that.
COVID-19 has really, oh, stop it. COVID-19 has really like I said, showed you what do I really want in
Yeah.
my life, So, but I remember posting in my private Facebook group that, isolating alone is hard. And somebody chimed in and said, it's hard for married people. Like the divorce rate is up. So what is your take on the fact that people who got married, now that they're actually living together, I guess, and spending more time, a lot of these relationships are now, I don't know, crumbling. What is your thoughts? What are your thoughts on that?
Well, I do believe that for many people, I'm just putting my foot up, that the distance makes the heart grow fonder. And we know, because I'm older than you, but nobody less than 100 has ever experienced anything like this. And again, I think the issues that were present are now exacerbated. And so what do we do with that? One thing that I think is critical for spouses is it is so important to know your love language and your spouse's love language. And so I'll give you a perfect example. My husband's love language is physical touch and quality time. And mine's is acts of service.
Wow.
Right. So acts of service and quality time, they complement each other. And so he's great. My husband is great because we work together and of course we sleep together. So we're together all day and all night. Now I'm about to strangle him. Okay, I'm about to strangle him. But he's great. And so again, I'm being funny, but you do have to know your partner.
Right.
For if they're not hopefully, there are a lot of folks who don't have a large enough space to have sides. So that means it's got to be a lot more conversation about who's going to be doing what and when. And that, if one person does need some private time and some personal space, people have got to be upfront and say that, and then allowing that space to have that time. What gets really complicated is when we have to have children. I think that's probably what is pushing a lot of families over, that there could be some marital stress, which is common. And then now you have children who are being homeschooled and because multiple structures or schedules have been modified. So everyone is adjusting to their personal structure. And now we have a new change in the family systems structure. So it can be very, very stressful.
So what advice would you give to couples? You said asking for your personal time. Anything else? Because I find a lot of us are more irritable than usual. Little things can just set us off. So what advice would you give to parents in terms of keeping the family intact during this time?
Well, one thing is I would try to stay on the schedule. So that's one thing. So let's go back to the beginning. So I would stay on the schedule, which is children need to still be in bed by a certain time, depending on the age. All right. We know that most kids, even elementary school kids, need to be in bed by 8:30, 9:30. And what I'm hearing is that kids are going to bed 10, 11, 12. Okay. So we know that when kids are getting up late, when they're going to bed late and getting up late, then they're not as rested, even us. Okay. A set time for eating. Also, it is, and I wish I had my magnetic responsibility chart, that making sure children are clear about what their chores are, and also what parents sometimes miss is they don't tell children what time to have it done by. A lot of children who have sort of that more of a stronger personality do not want to be told what to do and when. They don't want to be told you need to go do this. And parents are saying, a lot of times parents are saying, well, you're my child, so you got to do what I tell you to do. Parents, if you want to avoid an argument, just say, are there options of what they can do, whether or not you clean up the kitchen or clean up the bathroom, because just having that choice can make the child feel like they have some control, but also giving them a time frame. But that means parents, you will have to concede some of that some of that stronghold on your part. But if we were trying to decrease tension and the struggle, I really want to encourage you to be open to that. Making sure that there is some type of reward system. I still think that it works. And that means that you can use technology, because most kids have a lot of technology and there's a free reign to it. So it really still, because they're still in school, it's 2 hours of, it's no more than 2 hours of non-educational media a day. That includes telephone, video games, TV, Netflix, the whole gamut, and they can earn that. And because they're at home every day, they may be able to earn every 2 to 3 hours, 15 minutes of technology. So then they have that short, they have to do just a little bit for that reward, which really they can really reinforce what you want them to do. In terms of couples, again, I think it's a hard one, because the issues that were already there are just going to intensify. But let me just make sure I say this, that if there's any violence or aggression or abuse, then you do need to get help. Okay. Mm-hmm. If there's any undertreated or untreated mental illness, we also know that we also need that wife or husband or spouse, partner, that needs to be treated, because again, this time is a time that we've never experienced, and all of us are feeling more anxious, more irritable. We know that when people don't sleep, they're more likely to be more depressed, more anxious, more irritable. Another thing that happens is we don't have that emotional recovery time, control. So we're more apt to be provoked and react. Also monitor your alcohol and any drug use, because that's an issue. Also, and I said this on I think another video, be just aware about sex, because we know that couples are having sex, but both partners may not have the same sex drive because the person is feeling more stressed. So there needs to be a conversation about that. Some people use sex as a stress reliever. And one person is like, leave me alone, I cannot have sex. And the other one's like, give me sex all the time, because he wants to use it as a stress reliever. This is the time, again, to be mentally healthy. You're going to have a variety of stress relievers outside of sex.
Got it. So, what strategies should we put in place to come out of this intact? So one of the anxiety provoking parts about this is that we don't know when it's going to end. I mean, cities like Atlanta have been opening, states like Georgia, I should say, have been opening up. Last week we had the nail salons and the barbershops, and I think restaurants are now open as well too. So, but I don't think the deaths are slowing down. So I don't know when this is going to end, but how do we make sure that we come out of this mentally intact?
Well, Dr. Kelly, that's a loaded question. That's loaded, because let me just say, intact is relative, and it's going to be person and family specific. So I think that the more flexible we can be, the more and the more we can maintain just health standards. Again, the more that you are sleeping well, the more that's going to give you momentum. The more you remain healthy. So that means that this is not the time to be eating a lot of excess cakes and cookies and chips. So because we want to make sure our immune systems stay strong. We want to make sure we're hydrated, and those are basic things. And mental health is a part of health, and the reason why people have a variety of symptoms, we have the spiritual part, the psychological part, but we also have this biological part that some people do not agree exists, but it does. So your brain needs rest. Your brain needs healthy eating. Your body needs to be hydrated. So that helps us to feel well. I think another thing that happens that will have to happen is we do have to pace ourselves. I know that for when COVID first hit, a lot of folks were in shock, so just it's disbelief, and we're adjusting to not going to work and working from home. And now sort of that shock disbelief really has worn off.
It has.
Yep. So, right. And so now we're like, oh, snap. Okay, now what is this? Okay. And I think the more we can stay sort of rejuvenated in terms of eating and sleeping and exercising, the more that will help us to withstand this sort of overwhelming experience that we're in at this point. We do again have to think about your mindset, and that goes back to how you are perceiving this. So the people who think, and just like you, there have been a lot of studies that look at violence and abuse and post-traumatic stress disorder, and again, a psychological factor is how they think about the rape, how they think about it. If the person thought that, if the survivor thought that they were going to be killed, that increased the likelihood that they were going to develop PTSD.
Wow.
If the person was able to think about it as, this is traumatic, I am going to survive, I will get through this, then that person was less likely to develop PTSD. So again, how are you thinking about COVID-19? Are you thinking about it as this catastrophic event that will that's going to destroy the universe, including you? Then that is going to dictate those fear behaviors and those fear thoughts and feelings, which will drive you to become stuck and helpless and hopeless. So that's the main thing, but also reaching out for help.
Right.
We know that African American people under-receive treatment, and so, but we have a disproportionate. We're disproportionately affected by trauma and abuse. We are. And so then we throw this, then there's this global pandemic, and it is probably likely a time that a lot of folks now seek some treatment. So I'm just saying that for the record, ladies and gents. If you already knew that there was some anxiety and depression there, and you're feeling worse, that this is actually a great time to seek some support, seek some additional support in a way that you may not have sought it before. If you've been in therapy, it may be time to call the therapist up or get a new one.
Yeah. So why do you think that people of Black people, people of color, are disproportionately affected by trauma? You think it's a genetic thing? Because I've heard theories about, things like slavery affecting our DNA. Like, what do you think it is that causes us to be affected like this by trauma?
Well, largely it is our environment that we are disproportionately affected by poverty, and we know that poverty and sort of those social determinants that affect that come out of poverty, in terms of even, so what is even considered as traumatic could be crowding. That could be one. When we think about Maslow's hierarchy of the foundational needs, not having food, not having running water, not being in a safe environment, those things are traumatic. Not having enough finances to do what you need to do, that being a child not having a safe route to go to school, having to join in a gang to survive. So all those things, we call them adverse childhood events. All those things build up. We know that moving can be traumatic, and we know because of finances, some African American folks, families have to move more, and people of color, and also divorce. But also, and then even just the violence part, we know that African American women are disproportionately affected by intimate partner violence. We know that poverty in traditional gender role dynamics, that is a main indicator of violence. So that's just one part of it.
Okay. There's also still taboo about mental health illness and seeking mental health treatment, especially in the African American community. Have you seen that there's been a change in terms of how they view that, or still the same?
Oh, absolutely. We've seen such a increase in the people in our communities. And what I've seen personally is that is a significant increase in my patients 40 and below. So the 40 and above group, yay, we've done something right. So that means that we've worked really, I don't know how hard we've worked, but between these generations, that folks 40 and below are seeking help and seeking mental health treatment much more than the 40 and above. And just like in my practice, my moms who are late 40s and 50s and 60s, they will bring their daughters in. So I mean, my office, I mean, I constantly get calls from mamas. Oh, I think my baby is not doing well. And so that has decreased. Access has also increased in many areas, but a lot of areas still struggle in providing access. We know that there are more mental health programs. We have more people going into mental health degrees, but that's also a generational gap. So we know that the more therapists are, sort of that mid 40s and below, and and just like my mom is 75. My mom is saying, I'm not going to go to anyone that's 38. Right. I really want somebody that is my age. So there's also that generational,
Right.
and also finances. It's not free, and we're both in Georgia. Georgia is not a parity state, so that the reimbursement for mental health services is it's supposed to be the same, but in some ways it's still not the same. And also Medicaid, we didn't opt in so that folks who have Medicaid can automatically receive it.
Okay. So one question that I've been asked is, why are we having these like vivid dreams and nightmares? What is that about?
Well, stress and traumatic events can lead to vivid dreams, and researchers believe that this is due to the role that dreaming plays in memory and processing emotions. And people who experience post-traumatic stress disorder are more likely to have bad and vivid dreams. So again, it's tied to our memories, and it's tied to how we're processing our emotions. So it goes back to how we're dealing with our feelings. And that goes back to mindset, because we know thoughts and feelings go hand in hand. Thoughts and feelings go hand in hand, and they impact behavior. What is a dream? It's a behavioral action. Dreaming is an action. So the more we're not dealing with our feelings, the more that increases the potential that, because our dreaming is a part of the sort of the unconscious process. So we exist consciously. There's a conscious part of us and an unconscious part of us. So if you're not dealing with your feelings consciously, what happens, people, it's gonna play out unconsciously. So a couple things that we suggest is establishing a regular, relaxing routine before bedtime. So remember, and also that includes no technology 30 minutes before bed. No technology. No,
I need to work on that.
I know it. And also when you wake up during the night, no technology. It's because I said this on another webinar. I said, don't you remember when we were like little girls and little boys, and there was a bedtime routine? Well, many of us had a bedtime routine. You got ready for bed, you showered, or you changed into your pajamas, you brushed your teeth, hopefully wash your face, and maybe there was a bedtime story, there was a wind down. There needs to be the same thing. But most of us don't do that, right? We just, we get ready to go to bed, we take our clothes or not, and brush our teeth, and then we just jump in. Okay, so that really doesn't prepare the mind to relax in order to transition into sleep. Okay, talking about the dream can be really, really helpful. Talking about the dream, getting it out of your sort of beingness, and looking at what could it mean. And then another thing that can be helpful is rewriting the ending. Rewriting the ending, because and people typically don't do that. What do people typically do? We often we wake up abruptly from the dream and we're startled. Sometimes we can be really overwhelmed because a bad dream or nightmare it can destroy your whole day, can it?
It can.
It can. So at that point, if we rewrote the ending of the dream, then what would that look like? But also what we can do is compartmentalize. But the last thing is, if we're not dealing with our feelings, we've got to make sure that we're dealing with our feelings in a different way. Example, if we are depressed most of the time during COVID, we've got to figure out how not to be depressed. Okay, you've got to figure out not to stay in one feeling. But also, if you're happy, that's the flip side. If I'm overly happy, maybe I'm in denial, not dealing with the stress of COVID. Okay.
Okay. So you talked a little bit about anxiety and you're talking about mindset. So one thing that I know helped me, because initially when this happened, I was like, well, first thing, I was afraid of getting sick myself because I'm a doctor and I'm exposed to patients. But also even more anxiety provoking for me was that my family members, I can't control what happens to them.
Yes.
And my parents are in Barbados, and Barbados, no flights are coming in and out. So one of my fears was, if something happened to one of my parents, I can't even get to them. Yeah. And I actually started to feel better about that when I realized that I had no control and I had to give God control over what was happening. And I felt like a weight lifted off when I did that. So besides mindset, is there anything else that you would tell someone right now who is still kind of stuck in that anxious place?
Well, let me just say, Dr. Kelly, let me just say this part. I've been surprised about the number of folks who work in the healthcare system who have not been more assertive with getting their own PPE. I don't know if you've experienced that, but I have one nurse who's an OR nurse, and I said, "Why haven't you gotten any masks?" And he said, "Well, they haven't given us any." And I said, "Well, why haven't you just bought masks?"
Right,
I said, "Why haven't you just gone to?" I hate to say this. Why haven't you just gotten a shield from somewhere? Because we know how to get things.
Right.
I think that we have to make sure we have to look at are we sort of staying in a place of inactivity and passivity.
Mm-hmm.
And so I think so again, being as safe as possible. That may mean investing some time getting some additional PPE. It also means having some harder conversations. Like I had a patient who her husband is he's an extrovert, so his anxiety about not being able to connect with other people is getting really high. And I said, why don't you just have a conversation about your family unit and the other family unit, you all talk about what your exposures are going to be. And so you all decide that we're not going to do anything else but to interact with this other family, because they're both two families that are transplanted to Georgia. But when we're together, we will use a certain mask, and this will be at the level of social distancing that we're going to have. And so I think that people are not as proactive with those conversations as they could be. And also, even with family members, I had one patient who said that they felt guilty not wanting to hug their family member. And I was like, are you kidding me? This is a pandemic.
Right.
Why are you feeling guilty about not hugging especially because that family member's spouse was in the hospital?
Wow.
So I think it is very important that we have some different conversations about safety. And again, back to what I was saying earlier, if there are issues with communication within the family system, then COVID is just another example. There were probably issues with boundaries and not being upfront, not asserting yourself before, and then this just happens to be now that you don't want to tell them that you feel bad about hugging it.
Right. So open communication is necessary. What about depression? We didn't really talk a lot about depression, but I read somewhere that these feelings of isolation, if they last for too long, can eventually lead to depression. Have you been seeing an uptick in your patients who are coming in for depression or having difficulty managing their depressive symptoms?
No. Well, let me make sure everyone knows that depression and anxiety go hand in hand. So I know I was talking a lot about anxiety, but there would have been anxiety depression. Okay. So they go hand in hand. And so people have been presenting this with that sort of that combo. Another thing that people haven't been talking about is grief. That the loss of relationships, the loss of the consistency, that's a part of it as well. And so that is denial. And then there's the Kubler-Ross talked about the 5 steps, and sometimes we can sort of think about it very concretely. So it's this step, then this step, this step. And that's not typically the case. It doesn't usually go down the line, because oftentimes it's like this.
Like life, right?
Right. And even if we get to acceptance, we still may go back to the beginning. So people have been presenting with more just physiological issues, that they haven't been sleeping, they're not eating, they're snacking more. Not a lot of thoughts of death, no increase in suicidal ideation, just personally in my practice. And but also what we've seen is but amongst child psychiatrists, that the number of calls to child psychiatrists overall has gone down. We were surprised.
That's surprising, right?
Well, it is, but then once we think about it, sort of over the typical time frame, typically calls to child psychiatrists go down in the summertime.
Is that because children are with their parents more, or they're not at school?
They're out of school.
Okay.
School is a tremendous stressor. So yes, folks, a lot of kids are going to school. Most folks are going to school, even though it's much shorter. They're still out of school, but also many children are engaging their parents in a different way. So that level of closeness for many children is desirable, and vice versa.
So you talked about suicide, and one question I had on my list to ask you was about the mental effect on healthcare workers. You know, we have mutual friends who are doctors.
Yeah.
I got a lot of friends recently who were nurses on Facebook, and hopefully they're listening to this. And then I heard the story about the doctor in New York who was she was the chair of emergency medicine at a hospital there, and she actually committed suicide, and allegedly she didn't have any like mental health issues before. What about the effect on healthcare workers, on first responders? You know, how can we compartmentalize in a way and not bring work home, not bring the sight of people dying or not being able to help your patients? How do we protect our mental health?
It's going to be, you all are going to have to, because I do all telemedicine from my dining room. I think that this is going to be, I'm a believer, but this is, for many of us, is going to be a come to Jesus moment. The level of trauma and that you all are experiencing, I'd say we, because I'm a part of the healthcare network too, that we're experiencing is unbelievable. But what did I hear? That there have been more deaths from COVID than all of the Vietnam War, and that went on for years. And so I would not, any consistent mental health changes that you're experiencing, I really want to encourage you to take it seriously. If you're not seeking, if you don't have a psychiatrist or therapist, then talking to your primary care doctor is important. What I know as a psychiatrist, that utilizing my family got to be overwhelming for them. And so like when I was in fellowship at Menninger in Houston, at one point, both my mom and my sister said no more. And so as healthcare workers, even before COVID, oftentimes we're using our family members. So, and I think it's also great to vent and connect with other other peers in our field. But even then, oftentimes it's just a circular venting. And venting can be helpful, but if we're staying stuck, if we find that it's harder and harder for us to go to work. I have a client whose sister is crying every day. And so at this point, she's not going to work. If you need to take leave, you do need to ask for it. If you need to see a therapist because you know your sleeping is off, and we know the healthcare providers, we are the worst, right? We are the absolute worst patients. We do not seek help. That this is not the time that you continue to not seek help, because the level of violence, it's aggressive. I mean, this thing is overwhelming. What people have seen is a violence to the spirit.
Yeah, say that again. Say that again.
Violent is violent to the spirit to see the level of despair and this death. I mean, when I heard that one patient's dad died on the floor in the bathroom, and she was removed because of by security because she was overwhelming. I'm sure that was just so disruptive to everyone's being. So please seek help. It depends on your baseline functioning, how you were before. That will determine how you end up. But please seek help. I spent a lot of time. A personal story. When I was working in a psychiatric hospital. At one point, I felt myself getting very overwhelmed. I would be working 10 hours a day, and just really, I would come home crying. I hate this. My parents knew, my sister knew. And one day I was sitting there and I felt my spirit becoming hysterical. And I knew, I was like, now I have never felt that experience, that feeling. And I resigned that day.
Wow.
Because I knew the Lord had said to me, you can't withstand that. Now you could have withstood this, even though you gained weight and you're unhappy and all of this. But that feeling right there, that's the one you will not recover from. I wrote that resignation letter that day, and I was out. I was like, I don't care about my loans. I got to get out of here because I could just lose my mind over that one.
I hear you. So quickly, just 2 last questions. It's been a wonderful discussion. How do I know? How does someone know that they need to go in for help?
Okay. How you know is if you are having consistent, and consistent does not mean all day, every day. Consistent means more days than not. Let's go over clinical depressive symptoms, that your mood is low or you have disinterest in the things that you like to do, and 4 symptoms. So that's a decrease in appetite, or you're eating too much, or changing appetite, change in sleeping, either too little or too much, still not feeling rejuvenated, decrease in concentration, decrease in energy, helplessness, hopelessness, worthlessness, thoughts of death or suicide, can feel really revved up, or just really feeling sluggish, or I'm gonna throw this in, decline in sexual libido. You only have to have those symptoms, those 5 of those symptoms, more days than not for 2 weeks, and that is a mild clinical major depressive disorder. So if you are experiencing that, I need you to be aware of that. If you're having thoughts of doom, pending doom, like I have a patient she begins to sweat, her heart races, she feels like she could pass out, and you notice it and it's ongoing, you do need to get help. I had one patient who had this experience. She was on 7585, which is our main freeway.
Whoa.
She almost had a major wreck with people in the car. You do need to get help. If you find yourself going to work and you cannot function, so we think about symptoms, but we also think about impairment. If your concentration is so low that you're not able to perform your duties, if your coworkers, I had a patient who said that she could not perform her duty. Her coworkers recognized it and they took up for her. I mean, they did her work for her. Then that is an issue. If you feel like you just don't want to go, if you have aggressive thoughts about hurting anyone, because we know tension is high on the job, then you do need to seek help. And again, if you're having thoughts of death or suicide, contemplating what death could be for you, contemplating what would happen if you were not here. We also know that there are passive ways that people kill themselves. They stop taking their medication. They stop. And also drinking. If you feel like you're drinking more and you're using drugs more, those are the main reasons why you've got to seek help.
And psychiatrists, psychologists, they're still having like visits by video or telephone. So if you need to get help, please reach out. They're still seeing patients. Dr. Sherry, one last question. Do you think we're all going to have PTSD after this is done?
No. Why? What's that? It's the mindset. That is
Mhm.
key. And also making sure that physiologically we're doing the things that we need to do. So I'm making sure that I'm sleeping. I'm eating better now than I did pre-COVID. Okay.
Me
I
too. Like I had these 5 pounds that was just stuck.
stuff.
And I've been able to lose about 6 pounds over the last 4 to 5 weeks. I'm like, dang, I don't need my gym. I go walking at the park for an hour. So
Yeah, absolutely. We're staying hydrated. What I do is I limit my media. So I'm
that's a
not
good point. How much media time should we really have every day?
I'd say maybe 15 minutes,
Oh
maybe
wow.
3 times a day.
So no like obsessive Facebook scrolling,
Oh,
right?
absolutely not. And making sure that you're scheduling in some fun that I don't schedule in some fun, but my husband and I, we have mental health right now. So that's a good thing. We laugh, but also I encourage my patients to look at funny movies, things that are light, sitcoms. This is not the time to read really negative stories or anthologies. I mean, if you can handle it, that's one thing. But you got to have some joy. Also, doing some different types of activities. I know Dr. Kelly is going to be doing some embroidering. Really want to. This is a great time to tap into some different parts of ourselves at this point.
Dr. Sherry, how can we find you? How can we follow you?
Okay, so follow me on Instagram and Facebook. I'm more active on Instagram because I think it's pretty. At Dr. Sherry Psych. That's DrSherryPsych. Dr. Sherry Psych. And my website is drsherrypsych.net. Also you can do some hair stuff. You see, I have a new hairstyle. I didn't have this hairstyle pre-COVID. And we're gonna get Dr. Kelly to do her little stuff.
Girl, these braids ain't coming out anytime soon. But before I go, I wanted to invite you guys to my free diabetes webinar. It's happening this coming Thursday, May 7th at 7 o'clock Eastern Standard Time. I'm going to put the link in the chat where you guys can register. But over the last couple of weeks, a lot of my patients who have diabetes have been calling because they understand that they are at an increased risk for severe complications and even death from COVID-19. And I've been sharing with them the top tips to really bring their blood sugars down. If you have diabetes and you've not taken your blood sugar seriously, now is the time to do that. And it also affects your mind too. Dr. Sherry, I did a talk about diabetes and mental health a couple of months ago. But so it all comes together. Anyways, please sign up for the free webinar. Dr. Sherry, thank you so much for joining us. We've been talking for almost an hour. Let me see if I have any questions before I let you go. So some folks were saying hello. Hi, Dr. Renee. Hi, Francine. Hi, Dr. Tulu. Hi, Dr. Monica. All these doctors are here.
Yeah.
Dr. Tolu. Hi, Annie. Everybody's saying it's good stuff. So I think this was a really informative. And this is Dr. Sherry's Instagram. Dr. Renee, thank you for putting that up for us. So please go follow her. She really put some thought-provoking things up. One thing that Dr. Sherry always says is that, what'd you say about God and therapy, and that you can have like God, therapy, and medication coexist or something?
Yes, all coexist because all things come. This is my belief. All things come from God. God created every single thing, so everything can coexist.
Yes, so God, therapy, and medications coexist. So anywho, thank you for logging on. I'll see you guys next time. Bye-bye.
Bye.